And then any ideas you may have for going forward and sustaining your efforts that might spur on each other and give each other great ideas. So I'm wondering if Dr. Patterson could go first, and just as a reminder, on the screen you can see his target population and when they went live. But Dr. Patterson, if you could just share with us, after our wrap-up meeting, what did you feel was the biggest learning from your standpoint, looking at the data?
Hi, everybody. Glad to have participated in this with everyone. And thank you to the folks at the Center for Youth Wellness for MPPC for making this happen. One of the biggest takeaways that I had is that, one, this is really worth doing, and that people appreciate the fact that you've done it. I have been able to more easily have conversations about what are sometimes difficult things with family members, and it's almost as if they're bringing it up just because they answered the questionnaire before I got there. It's not just me kind of grilling them to get into their business. So I think that a lesson that I had is people are willing to talk about this and wanting to understand what things mean for their children long term, and it gives us a chance to understand something that they may not appreciate as much. Kind of another takeaway is that I have to be a little more structured in finding resources to plug them into that takes a trauma-informed approach to the care that they provide, and that the needs that people have are varied enough that we need to cast a wide net on resources that we have available to them. Anything else, Jared, that I left out? We also learned that insurance companies will reimburse for this work.
Good one. Thank you.
We found that, what was it, Jared? 85% of the time they did reimburse us.
Yeah, 85 to 90, somewhere around there.
Yeah.
And what are you billing with?
It's a screening code. I can dig one out for you and let you know in just a minute, okay? Because I just did it the other day. Let's see, let me find a 9-year-old Zoe Sampson.
Really quick, while Dr. Patterson's looking that up, one thing we've also done on the Prime Med side is we've begun to engage our payers to not only increase the rate, or increase the actual frequency of reimbursements, but also in talks with them to increase, of course, the actual rate of reimbursement to hopefully convey to them the actual amount of not only the value of this, but the actual amount of coordination involved, the amount of work that goes into this beyond just a regular, here you go, screening kind of thing.
I found it. It was the focused HRA instrument was scoring 96161.
Yep, thanks. I just found it. Thanks.
You're welcome.
Yeah, so 96161.
Dr. Shriver, that's in the tips for coding that we gave you in the implementation guide. It's just like a 2-pager. Yeah. But I can
we need to get our people trained on that. Thanks, guys. You guys are so helpful.
Yeah. Thank you, Dr. Patterson. All right. Dr. Dawson, you're up next. Again, her screening protocol is there, and her go live date. Y'all are all very closely in line and starting. So that's been really nice that you've wrapped up together and have been on a very similar journeys. What were your biggest learnings?
I think for us, it's been, we were pleasantly surprised that how receptive our population was to being asked these questions. And we really were worried about people freaking out a little bit on it, and they did really well. And maybe that's because we've been screening for other things for a while. We were, had such great training and preparation getting ready to go live. I would say the biggest thing that we've learned, and now we're screening 2 through 6-year-olds now, is that we kind of expected our rates would be higher than the national average, and they certainly are. And I think the biggest thing is like you're just kind of scratching the surface by starting screening and asking questions. That we really have screened very effectively, but have launched a lot more initiatives into trying to prevent this, and also trying to mitigate the effects as they go, using all of the wonderful resources of CYW, but then adding additional stuff, learning about sensory motor types of interventions. We just launched Healthy Steps, which is, we have a Healthy Steps specialist to really help our parents who are struggling. And all of that kind of came out of really delving into the ACEs work and knowing that we need to get to these parents very early on, before these problems start happening, and kind of deal with that transgenerational ACEs. And so just there is so much work, great work to be done, and so much prevention. I really feel like I was talking to a nurse the other day she's one of our school nurses in the community. She's like, y'all are really changing this community and making things better. So I've been really encouraged that this work can really change lives, and break these cycles of poverty and violence. And so we're really excited and excited to look at the next chapter and build more trauma-informed care systems in our region. So,
Dr. Dawson, that is such a great story. Thank you for sharing that. That is very touching, and it is encouraging. I get to live vicariously a little bit through you guys, and hear the wonderful things that you're doing, and how they're shaping the community. So that's wonderful to hear. Great. I'm hearing a theme that you all are needing to see and look for, engage with better trauma-informed care services. So I may want to ask for some additional thoughts on that, to help us at the Center for Youth Wellness as we think about our next steps as we help those in the community as well. I'm afraid Dr. Shriver may have had to step away for a patient. It looks like she might have. Such is life, that happens. We'll come back to her if she's able to rejoin us. So since I brought it up, can Dr. Patterson or Dr. Dawson, have you had some negative experiences in referring patients out to services and you felt like they weren't trauma informed, or they re-traumatized your patients? Or how have you identified those needs?
So definitely, because of my interest in ACEs and kind of putting myself out there with our community organization, and linking up with schools, I've ended up with some patients who have, kind of complex trauma from, early on, and they really are mismanaged grossly, put on numerous mood stabilizers, antipsychotics, still not getting better. I was just on the phone this morning with someone trying to get a patient into trauma-informed residential treatment, which is just, I think there's probably 10 or 15 in the country, and half of them are in California. So it's been really, really a struggle, because I know that there are things that will help these kids. And we've had some success building kind of in our mental health for the more garden variety, more minor trauma situations. But once it gets to be complex, it's really been a struggle getting them anything beyond lots of medications, and then just, not really having any sort of outpatient or inpatient. There's really not much trauma-informed treatment beyond us kind of building up our mental health resources around us to help instructing them. But now that we've got our organization, we have had some success in people hear about us and then come to, with us being on Zoom now, our meetings have turned to our Troy Resilience Project meetings are on Zoom. And so actually had some uptick of people who are, 50 minutes away that are trauma informed. So we are starting to build that, but it has been very frustrating, especially for kids in crisis, to find them somewhere when I can't even send them to the Children's Hospital for psychiatric care because they don't address their trauma at all. So that's been really frustrating.
Yeah. Well, that's the first positive I've heard come out of Zoom. I mean, come out of COVID. So that's also good to hear. That's it. That is true. I'm sure that community coalitions have had some uptick in participation. So that's a good one. Dr. Patterson, have you seen similar things in not having trauma-informed resources, or is it that you don't, that they're not, it's not, the referrals aren't going well, or that there just really aren't the services available?
Sometimes the referrals don't go as well. Sometimes the system is just overwhelmed. I think that's one of the problems that I have with our children's hospital here, is that the system is just so overwhelmed with kind of putting out fires, that it's hard for them to clear the brush a little bit. And so with many times when I send a patient to our psychology department, and definitely when I send them to the psychiatry department at the pediatric hospital here, we find that they're not accepting patients at this time.
Yeah.
They just don't have the capacity. Some of the resources that I thought were in place were some kind of smaller community-based resources that I just have a feeling COVID swallowed,
Yeah.
and they were having a hard time kind of surviving. But that's why one of the next things for me is to be a little more purposeful in trying to develop formalized relationships with a few of these organizations. But likewise, I've found one or two that were good ones to be a part of, that I think have added to my ability to get kids in, that take a broad approach and do a more judicious, have a more judicious approach to some of the medications, and relying a little bit more on some of the behavioral management. My population that I was targeting is a little older than the other two groups. So I think that most of them, this one particular resource would tend to hold off on medications until they're getting a little older. But a lot of times that is the approach, just throw more medicine at them and see if something sticks.
Yeah, I agree. That's a great thought too. To really kind of getting in during this time, getting to know some of your community based organizations a little bit better. I agree. I think we all know COVID's been very hard on nonprofits. It's hard to deny that. Dr. Shriver, are you in a space where you can talk for the moment?
Hi, yes, I'm sorry. I had to go see a patient. I
No,
blocked my schedule and then that doesn't always work apparently.
No, that's okay. It's okay. Just wanted to hear what your biggest learnings were from your screening efforts.
Yeah, so first of all, I learned how important it is to continue to educate the entire staff on ACEs and how to do this ACEs screening. We have staff turnover, we have new staff coming on, and so in order to do this effectively and correctly, we need to continue our education of staff. And I totally echo what Dr. Henderson has said. Doing this has been a positive experience for our families. It's increased their awareness for a lot of our families. It's increased their gratitude. They feel, in the most part, very accepting of the fact that we're doing this screening, and it has helped a lot of people understand stress at a new and different level. So we're able to have conversations we weren't able to have before because of the training. And I haven't started the billing yet, so I really appreciate this group as a motivator to be able to do that. And one thing that we already had in place was really good connections to our community. But getting this data will really help our Help Me Grow affiliate with their work. So I think there's a back and forth there, right? So we're always helped by them, and now we can help them as well continue to be funded and to continue to grow and expand. So all of that has been very beneficial, and it's really motivated us to want to do some adult ACEs screening because, we've been targeting some younger kids, and what we're seeing is we get a lot of zeros, and I think we might have a little bit more of a some revealing data if we screen adults at that age, because I think that if parents are stressed or have been stressed, we know that that can carry over to children, or at least we know that we need to provide extra supports for those families. So I'm really excited about the fact that this project has really motivated us to continue on and look at that.
Very good. And I will send you what California has approved for the adult screening tool, Dr. Schreiber. Yeah, so that you have that.
And I would just share with the other groups here that, discussing ACEs is important. What we've discovered over the last 6 months with COVID is that even if our families have 0 ACEs and don't report a lot of adverse childhood experiences, the overall stress of COVID has affected everyone's life. So what is a huge challenge, of course, is also an opportunity to really talk about stress in a strengths-based way that really supports positive and reflective parenting. So I know that Renelle and I have talked about the CC123 framework for talking about stress, but I'm happy to share it with you guys if anyone else is interested.
Yes, that would be great. I agree with you. I think that, quite frankly, in the coming years, we'll have to adjust our ACE scoring, because I am becoming a firm believer in the fact that universally, in the United States at least, we have all experienced 2 ACEs in the last 6 months with the pandemic and with the racial injustice and violence that we've seen in the community, we've seen on television. You couldn't really have not seen it, and that if you look at the bottom section is one of those additional adversities. So we've all experienced 2 ACEs at least in the last 6 months, and for those of you that are on the front lines working, I mean, you really have a third ace in what you do every day. So, we certainly do appreciate you, and honor how hard you're working right now as well. So thank you for that.
And I want to piggyback on what you said. I first of all, I appreciate you acknowledging the stress that we are all experiencing. That is so important. And yeah, the third ace, I guess, of just being in the clinic. Um, we do a lot of screening, and so in addition to the ACEs screening in our clinic, we're seeing our PHQ-9s go up, and we're seeing our body mass index go up. So COVID has a lot of effects. When I talk to my tweens and teens about their PHQ-9s, they're telling me, for the most part, some of them have anxiety and depression, but for the most part, they're just like, no, Dr. Shriver, I'm just lonely AF. And so I think that is a good message for us as to the direction we need to head. We need to be more cognizant of the loneliness of our kids as they move forward with COVID, and then also and find ways around that, creative ways. I know people are trying, but so far it's not enough around here. And then find solutions to the dramatic increase in body mass index, which is going to just cause a lot of downstream problems as well. So sorry to be on a tangent, but screening is important. That's our job. And right now we can see the effects of stress on people's lives in these forms as well.
Yeah, absolutely. Absolutely. I'm sad to see that my BMI has gone up too.
Yeah, I've noticed too, like you were saying, it's also a good opening, because parents get that they're stressed, their kids are stressed, and so I'm like, everybody has an ACE right now, but we're asking you about these, and these, because we go ahead and give them information on it, regardless of their screening. These are some resources for you. Please,
yes. Have you guys
incorporate those?
Have you guys heard me talk about CC123 before? I know that the Center for Youth Wellness folks have heard me talk about it, but it's just a really great thing to talk about for every single patient that you see that comes through, no matter if their ACE score is 0 or 10. And so we just talk about that stress is real and that it's out there for everyone. And the first C we talk about is connections, right? When we're far apart from our loved ones, we need to feel connected. And then that looks different for different age groups. And that the second C is coping. And that's an important place where we can slide in that the 7 tenets for good health, right? Which I've been sliding in almost every day for myself and my kids and for everyone. And then I talk about routines and rituals in that little spot as well for kids, and make sure that parents have some self-care as well. And then the 1, 2, 3 part is about how to parent during COVID, or really any time, but when kids are starting to act out or demonstrate their stress and anxiety, take one moment to stop, reflect, and then hopefully feel and forgive. And that's a time where I often ask parents to forgive themselves as well for being imperfect people. And then 2 is 2 eyes for seeing and 2 arms for holding. And just a reminder that we all need more positive attention and physical affection during times of stress. Not all of us, but pretty much most of us. And then 3 is, what are 3 ways you can show your child you love them every day? And then what are 3 ways your child can show you they love you every day? So it's a challenge, for families to come up with those 3. And I just asked a 5-year-old today, and she was like, well, I don't know. And I'm like, well, what do you do when you love someone? And she's like, well, I hug them. And I'm like, see, that's a great way. And she figured out 3 even just in front of me. So it's a great strengths-based way parents and children feel cared for when you talk about stress in that way.
One of the things that we did just to get more information out there to parents, we have in our exam rooms are large, they look like big tablets, but they're part of the Power Patient Point information system. And we designed several slides that talked about ACEs, talked about what ACEs are, talked about the effect they can have on cardiovascular system, endocrine system, all the different systems that can have impact, and put them on there so that they rotate through, so that as people are in the room, a lot of the kids actually mess with this more than adults do, but the children have a way of getting the parents' attention to it when they see something that they notice. So, you know, some of them have pictures of hearts on there and stuff like that. So that information is constantly available, so that while people are there, they might happen upon some information that they can make use of.
That's great. Those are great ideas and concepts. I love that. Dr. Shriver, I've been trying to look up some additional information on CC123. Is that your?
Yeah, it's really hard to find info, isn't it? Because it's something that I developed when working with the Iowa ACEs 360 Coalition. So it's not anywhere yet on like accessible on the internet. You can find it if you dig really hard into the Iowa ACEs webpage, but it's not searchable per se. I actually been working with 0 to 3 to try and get them to put it on their webpage there, but there's a lot of hoops to jump through to get it to be done there. But I actually think it should have a place on the internet. It just doesn't yet. And so maybe you guys want to put it on your page. I don't know. I think people are hesitant because it's not evidence-based per se. Like no one's put it through any clinical trials or done any validating of it at any level. But it's really just evidence founded, I guess, or evidence like informed. And so it definitely does no harm and does a lot of good to my patients. So I can testify to that. So yeah, it's not really easily found on the internet, but maybe we'll work on that together.
I would love that, and I would love to see you know, you write an op-ed for the Journal of Pediatrics just on coping strategies right now. I mean, just for it to get it out there, that would be great. But let's talk more about that. We'd like to help you with that.
Sounds great.
All right. Well, I know that you all are very busy. I think I'm going to be able to give you a few minutes back. I do want to talk to you a little bit about our Learning on Demand courses that are available in the hyperlink that Murnell has just highlighted there. We do have 4 courses available with CME credit. Those are, and they're right on our web page. So the course 1 is the Science and Foundational Framework for ACEs with CME and MOC credit. And then we have course 2 is Planning and Developing Screening, which you all are very well versed in, but might be great for groups you're working with and or new staff that come in. Preparing your practice for screening, this delves more into the EHR and the quality and improvement aspects, as well as self-care and some of those trauma-informed concepts. And then our 4th course is best practices for communicating about ACEs and empowering families. So that also has information about motivational interviewing and using OARs and some of the sample scripts and patient education job aids that we shared with you. We do have one other class that is available from some of our other work, and that is our NCATS, which is the National Committee on Asthma and Toxic Stress. So that is also available to with the CME credit on our web page as well. And the last thing I would say is we may have some opportunities coming up in the future for a speaking engagement or a panel discussion with either some of our local convenings in and around ACEs in California. So as we have approved reimbursement for screening through AB 340, we have groups that want to learn, what does it look like, and what are the lessons learned. And I think that peer-to-peer learning is the best opportunity. So as our engagement wraps down, I would encourage you all to send your final invoices, and then I may be reaching out to you all in the future to talk for 10 minutes or so with regard to a panel discussion on some lessons learned that you shared here. And I hope that we can continue to engage with you and be partners in the future. And we'll make sure that you have our contact information going forward. And I also just want to give a little bit of space for any other announcements that you all may have, or any final thoughts you'd like to share with us at the Center for Youth Wellness.
Hey, this is Dr. Schreiber. I just really want to thank you guys. I've been working with ACEs for a lot of years, and without you there, it felt like we were all just swimming in an ocean, kind of lost. And then when you kind of took the lead and really helped bring a community together of people with shared interests, it really kind of helped move everything along in a really effective way. And I just always know that you guys are leaders in this work, and that we can always collaborate, work together, and learn from you. So thank you so much for being the leaders in this work, and for helping us all understand what we should be doing and how we can better serve our patients.
Thank you so much. We appreciate it. And
Yeah.
it's been a pleasure.
Yeah, I would definitely agree with that, because we were, kind of doing some here and there, but having, that time devoted, the team support was crucial to get things started. But I think the web platform is a great kind of segue to getting more people access, because obviously you can't do as intensive as we were lucky to get. And I just think, I didn't say it in the, I was talking about lessons learned, but I was thinking as I think you can do screening and referral and building relationships outside of your clinic without needing extra personnel. But we've learned and over time that I think it really does help us, empower us to have that added staff member now, to really kind of take the reins when we get some families who are struggling. And I think it's going to really provide a tremendous impact for our families over time, because there's just they just really help bring everything together. So I think that would be, and I know y'all encouraged that at the beginning. We weren't quite there yet as far as funding and stuff, but I think in the end, it's going to not only benefit our patients, but it helps our flow and helps us get families connected to what they need, and helps us be less burned out and stuff too. So I think that's another thing. It's worth it to have that extra set of hands and eyes to be able to hand off to carry it forward. But it's been a great journey, and we look forward to more to come.
Thank you.
And I would just kind of add to that that's part of our rationale for working with our insurers. As care management, as contracts with insurers include more care management and shared savings opportunities, this is an argument for why we deserve more of that reimbursement, not just for completing the form, but for doing the work. And that's where you get the funding to have that person, and showing that this is, I think it helped that the tool was validated, and that all of that happened for all of the folks who really feel that you can only do evidence-based validated tools. It allows us to close the loop on that argument and say you can't say that this isn't one, because we have the proof, the evidence to show it. But it gives us kind of some stronger legs to stand on. I think the more we do of this, the better we'll get at addressing these issues early on. Certainly our children deserve that.
They absolutely do. And you're absolutely right, Dr. Patterson. If you think about it, another way to talk to the payers is to say that this is really this is a population health intervention. So they can pay for it now and get the prevention and intervention that goes along with it, or they can pay for it later when it looks like diabetes and or heart disease and obesity, or likely all three. So I think that's a great way to approach it. I thank you all so much for your time, and I'm going to give you a little bit of time back today, and we will be in touch soon with some additional information and ongoing information about how to contact us and how to get information about the learning management systems. And again, Murnell has left you a note to send your invoices to the email there, finance@centerforyouthwellness.org. All right. Thank you all so much. We appreciate you, and it's been great working with you. I hope you have a great rest of the day.
Thanks, Carissa.
Thank you, guys.
Thank you. Thanks
All right, thank
so
you.
much, you guys.
All right.
Thank
All right.
you.
Bye.
Cheers.